Welcome to this presentation entitled Domestic Violence, Strangulation and Concussions. Some comments. This is a topic that's incredibly overlooked and underappreciated. It seems that these red flags of domestic violence are never discussed, and that being strangulation and concussion. And here's a warning before we start our PowerPoint presentation and some relevant information. Domestic violence occurs within intimate partner relationships, and it's called intimate partner violence, IPV, and it can occur in all kinds of relationships, including those that are newly formed and LGBTQIA+. And dentists play a role in identifying family violence. This is an article that was put up by CDA, stands for Canadian Dental Association. Another one by the Canadian Dental Association, Professional Issues, Domestic Violence and its Relation to Dentistry. We're going to be referring to some of our reference sources, one being the University of Western Ontario, where they, as most of you know, they have a Center for Research and Education on Violence Against Women and Children. Another organization, the CDHPI.ca, which is the Canadian Domestic Homicide Prevention Initiative. And it says here, domestic homicides account for 1 in 5 murders in Canada. And then we also have in Ontario, the Ontario Coroner's Office. And the coroner is the investigation and review of deaths. They also focus in on deaths involving domestic violence with a view to making recommendations aimed at preventing deaths in similar circumstances and reducing domestic violence in general. And one of the things that the coroner has is the DVDRC, which is the Ontario Domestic Violence Death Review Committee. Some statistics, women ages 18 to 34 experienced the highest rate of domestic violence. And it's still domestic violence. They don't have to hit you, choke you, or slam your head into a wall in order for it to be domestic violence. They can degrade you, humiliate you, blame you, scream at you, lie to you, cheat on you, and withhold finances, or even just try to control you. And some of these withholding finances, they can actually bankrupt you, especially if there's a joint account. And no matter what, it's still domestic violence. Only 25% of women report IPV, intimate partner violence, to the police. So we were missing a lot if we don't look at family court too. So what they're saying is sometimes you can look at the family court records and make judgments of women that are vulnerable to intimate partner violence through court proceedings. The role of the dental professional: 75% of physical injuries from domestic violence are inflicted to the head, face, mouth, and neck. So dental professionals, myself being a dentist, we are in a unique position to identify the signs and symptoms of domestic violence. As many abusers isolate their victims from friends and family, health professionals can serve as a safe haven for these individuals. And it's important for dentists to be educated to look and also to be able to try to provide help for these victims and survivors. A lot of abusers hurt victims in places others can't see, like behind the ears and around the neck, on the head, or in the hairline. That is not the usual place for people for cuts and bruises, but as a dentist, we look at these areas also. She urged victims, this is a guest speaker speaking on the topic, she urged victims of domestic abuse to remember they can anonymously confide in their dentist, who can then be able to get them help from charities or special organizations or the police, or if the patient is not giving consent, we just give them dental support and document everything with photographs and proper documentation and proper radiographic examination, so that in the future, if the patient changes their mind, they'll want those documents possibly in future court proceedings where the Crown prosecutor might lay charges against the perpetrator. So here's a new section. That was just our introduction. We're going into a new section. We're going to talk about strangulation. And again, here's another reference source, strangulationtraininginstitute.com. They're actually out of Australia, and it's a training institute on strangulation prevention and also all the information, signs and symptoms. And there's two types of strangulation, manual and ligature. And the manual strangulation is using the hands or forearm to strangle a victim, and may be the most common form of strangulation employed in the context of IPV. In contrast, ligature strangulation refers to the use of rope, scarf, belt, or other similar object to strangle a victim. Dentists see domestic violence more intimately than most people. To them, domestic violence can be loosened, fractured teeth, ripped flesh in the mouth, soft tissues torn in the mouth, fingertip-shaped bruising, where there's even on the arms, grabbing and pinching of the arms, blood vessel damage on the neck caused by strangulation. Strangulation is an exercise of power by the perpetrator. But strangulation is ranked as the more dangerous than other forms of physical abuse, and studies suggest that strangulation is often a predictor for homicide, and also repeated strangulation can lead to other serious health problems. So actually, a true statistic, being strangled increases a victim's chances of being killed by the same intimate partner by an increase of 750%. And the final, it might not be by strangulation, it might be by other weapons. According to the Training Institute on Strangulation Prevention, a woman who has suffered a non-fatal strangulation incident with her intimate partner, again, emphasizing 750% more likely to be killed by the same perpetrator, and even with a gun or other weapons. And if this does go to a court of law, terminology, if you happen to become an expert witness, is to distinguish between choking and strangulation by definition. And of course, choking occurs internally when something gets lodged in the throat, blocking the airway, impeding the airway. Whereas strangulation occurs externally when pressure to or on the throat impedes breathing and or circulation of blood. What happens at this, when you're interviewing a victim, they'll use themselves, the victim will use the word choking. But when it goes to a court of law and you're an expert witness, the proper terminology is actually strangulation. Again, another reference source, another organization, we've already discussed this one, the Canadian Domestic Homicide Prevention Initiative. And they're saying that between 30 and 70% of women who are victims of domestic violence have been strangled. Again, another thing is the emergency wards of hospitals. And here's a statement by the American College of Emergency Physicians on the topic of strangulation and neck compression. Another organization, ACEP Now, which is the official voice in the United States of emergency medicine. So the emergency physician should have thoroughly documented the injuries, specifically paying attention to location, size, color, and shape. Photographs of injuries can be valuable and should be placed in the medical record as per hospital policy. And again, for future court proceedings, documentation is very important. And then here's some of the signs and symptoms of strangulation. Mental status, lightheaded, dizzy, loss of memory, disorientation, loss of consciousness. There's behavioral. There's the head and face where you'll see subconjunctival hemorrhages, skin petechiae close to the site of strangulation, and those are called Tardieu spots, vision or hearing changes, swollen tongue or lips, the neck, symptoms of the neck, redness, bruising, scratches and fingernail marks, scrapes and abrasions, pain on gentle palpation of the larynx, sore throat, swelling, or ligature marks. And then there's symptoms of the throat, the shoulders, chest, respiratory distress, pulmonary edema. Pneumonia may develop, but is often delayed as much as 2 to 3 weeks. And worsening of conditions such as asthma, abdominal, renal. There's nausea and vomiting, involuntary continence, and sometimes causes a miscarriage due to fetal hypoxia. This is one of the charts that they would use in an emergency ward for the medical emergency doctor to do documentation of a victim that's a victim of strangulation. So the perpetrator, some of the red flags for a perpetrator, who would this perpetrator be? It's someone that might be using alcohol or drug abuse. They might have access to firearms, use of firearms during previous domestic violence incidents, and unemployment. The perpetrator might have problems with drinking, and the ones that do have problems with drinking was associated with an 8-fold increase in partner abuse and a 2-fold increased risk of femicide, attempted femicide. Batterers who strangle their victims are more likely to engage in other extreme acts of violence. It's a message that there are no limits to which he won't go. The odds are he's willing to kill, and that's a source from Psychology Today. But 50% of strangulation victims have no marks on their neck, but this doesn't mean that there's no injury. And again, here's the anatomy: the carotid artery, the jugular artery, the hyoid bone, thyroid cartilage, and the trachea rings. And often victims will experience a strangulation assault and they will appear fine. They will appear normal at the scene. So that's why this one gentleman, McLean, says that it's important for doctors, nurses, and the police and first responders to actually ask abuse victims if they've been strangled. And some of the victims, they don't understand that they actually have been strangled. They don't understand the concept of that word. So there's alternative questioning where one can ask, has anyone put anything around your throat? Has anyone applied pressure to your throat? And explore it from there, said McLean, because victims don't always understand that they've been strangled. And talking to first responders, the Prevention Institute says only 50% of strangulation victims have visible injuries in their necks. And of those, only 50% show up in photography. I would argue that if you use proper forensic photography with supplemental infrared or ultraviolet light, that 15% rate would be higher and they would show up in the forensic photography if proper forensic photography was performed. While there may not be marks on the neck, there are other indications to look for. The Training Institute says police and others need to check victims for signs like chest pain, difficulty breathing, trouble swallowing, sudden urination, headaches, and petechiae, little red spots in and around the eye. And again, here's a photograph. Now, these scratch marks are actually caused by the female victim. When someone's being strangled, they try to claw with their fingernails. They're fighting for their life to try to remove the ligature or try to remove the hands or ligature from the assailant. It says here, classic abrasions caused by victim's own fingernails while attempting to remove the assailant's hands or ligature. The vertically oriented pattern on the muscles, that it's a defensive maneuver, self-defense, where you're actually fighting for your life. Sometimes when officers arrive on the scene, it'll be the offender who actually has the injury, because if you're fighting for your life, what are you going to do? You'll do anything. So the victim is fighting back and scratching or even biting the perpetrator also as self-defense. Signs of strangulation, and here again is an illustration: the neck, the mouth, the eye and the eyelids, behavioral changes, the face, voice and throat changes, chest, breathing changes. Signs of strangulation. And here's symptoms related to neck trauma and the percentages that have these. And again, there's going to be neck pain, sore throat, changes in breathing, difficulty breathing, changes in voice, swallowing difficulty. And if there's some brain asphyxia associated with the strangulation, you're going to get vision symptoms, urinary incontinence, dizzy, lightheaded, and possibly loss of consciousness. And this is a police investigator, Officer Garrett, said that the internal injuries suffered can lead to blood clots, voice loss, and even deadly strokes. Plus, a domestic strangling victim, again, we're repeating this, but if domestic strangling victim, now this is from multiple different sources saying the same thing, 750 times more likely to be murdered by their partner at a later date. And again, we've already discussed this, the perpetrator red flags. And the thing about strangulation, it's a personal type of violence. It's up close, aggressive, life-threatening, even if it only lasts for a short period of time. Unconsciousness can occur within seconds, followed by brain damage and death within minutes. It's a purposeful and inflicts extreme terror upon the victim. Here's one lady, Georgiana McGrath, interviewed by the CBC News, Canadian content. She says that she's been strangled different times by different male partners. Here's one victim. This lady said, my ex-boyfriend was 7 seconds away from killing me from strangulation. Went to court with the Crown prosecutor, and apparently he got 5 months probation, no prison time. McLean said a normal man's handshake creates about 80 pounds of pressure per square inch, and that takes far less pressure to stop the blood flow to and from the brain. 11 pounds of pressure per square inch will completely block the carotid artery, which is the main artery taking blood and oxygen to the brain. 4.4 pounds of pressure per square inch will occlude or block the jugular artery, and that's the vessel that takes blood from the brain back down to the lungs to be oxygenated. 33 pounds of pressure per square inch will occlude the trachea. So with very little effort, you can occlude the major blood vessels and the airway and block air going to the brain. Here's injuries to the patient's neck and from strangulation. Here's the subconjunctival hemorrhages, a picture of what that appears to be. Again, some typical injuries from strangulation. And if you do an MRI from a strangulation victim, you might find hemorrhage close to a critical neck structure, an airway or a major blood vessel. You might find hemorrhage or congestion of lymph nodes, subcutaneous hemorrhage, intramuscular hemorrhage, swelling, bleeding in the platysma muscle, submandibular gland hemorrhage, and perilaryngeal fluid collection. And some of these victims, this is how they feel. This is how they personally feel. The psychological impacts of being strangled include depression, suicidal thoughts, nightmares, post-traumatic stress disorder, and more. And again, according to the Training Prevention Institute, 70% of women who have been strangled actually believe that they were going to die. Again, there is some training out there. This is a forensics learning series, domestic violence and non-fatal strangulation assessment for health care providers and first responders. So there is training available. But at the moment, Neither the RNC nor the RCMP give special training to members to ask domestic violence victims if they have been strangled. And I believe not only the RCMP, but even our local regional police forces in Ontario, I highly doubt that they've been trained either. And not only that, the training academies for police forces and even the training for dental schools, they're not training in the area of domestic violence, strangulation, and/or concussions. So again, a present goal and future goal is to petition and lobby for improved training and education, and it's required immediately. Common triggers for trauma reactions in the dental practice. So some of these patients will then have to seek dental treatment from their domestic violence abuse. And some of the triggers in a dental office that will cause dental phobia for these patients, approaching the patient wearing PPEs without taking time to establish rapport and trust beforehand. Laying the patient back in the dental chair, this could feel like a vulnerable position. Placing instruments inside the patient's mouth. Close positioning of the dental staff in relation to the patient, especially if the staff members have not been introduced. So you have to establish a relationship of trust. And inadvertently touching the patient around the face or shoulders during a dental procedure. Shining the dental exam light into the patient's face and eyes. And even in a dental office, some smells and sounds can be perceived as threatening or prompt recollection of past violence. Going on to a new section entitled Domestic Abuse Victims and Survivors, Some Images. Again, this is from the Toronto Star newspaper, where this lady, her boyfriend had actually did violence and actually bit her nose. Her nose was bitten off. And then here's another, again, the University of Western Ontario resource, where they're saying the prevalence amongst Canadian dating violence, and that youth between the ages of 15 to 24 in this dating violence category, they're at the highest risk of domestic violence. Females aged 15 to 19 experience 10 times more instances of domestic violence. And again, going into emerging adulthood, there's financial and living independence, taking responsibility for oneself, independent decision making, but it makes the youth vulnerable. Here's one lady. She was a victim of severe domestic violence, attacked by her then boyfriend. She defended herself and in self-defense killed the perpetrator. Another lady, this lady's actually from the UK, from Great Britain, and they actually, in her honor, they created a cell phone app called Hollyguard, and it's actually hollyguard.com, but it's not available in our country. By shaking the phone, it can alert others that you're in danger. That's part of the app. And she was a hairdresser, murdered by her ex-boyfriend, and he's jailed for life. And again, these Hollyguard app, but not available in our country. Another lady, Ruth Williams, strangled to death by her husband, Anthony Williams, in 2020, and that is in United States, Pennsylvania. Here's a testimony of their own words of a survivor. She said, "My teeth are falling out due to continual stress for the last 6 years." Another domestic violence victim said, "Not eating, not sleeping, not taking care of myself properly. And at the last dental appointment, she said, I'm going to lose most of my back teeth or all of my back teeth. And she said, I can't believe what this has done to me." Again, here's another lady, a victim and survivor of domestic abuse. Again, don't wait until the last minute. Try to get help. If you were in an abusive, toxic relationship, try to get away. And here's another lady abused by this perpetrator. Here's one, an attacker left the woman with a bite mark to her face. An attacker who left his partner with a visible bite mark to her face after a violent assault has been jailed. And here's a final section. Our final section is on domestic violence concussions. This is a skull that I actually own. It's from the Ganges River in India. It's for scientific purposes. And what I've done, I put black magic marker marks here, 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 and here. And these are possible areas where you could have a jaw fracture from domestic abuse, from a blow to the face. The condyle on the lower jaw of the TMJ, temporal mandibular joint, that could snap there, or fracture here, or fracture here. And if I may say, God has designed our skull that all this area here is collapsible. It's just like a car. When we get in a car crash, they design the front end of the car to collapse to protect us in the automobile compartment wearing a seatbelt. It's the same kind of design here. This front of the skull is designed to collapse with the sole purpose to protect the brain, to keep us alive. And again, this is the inside the skull with the skull cap removed. And again, this is not a fixed organ. The brain actually is like a piece of jello surrounded by cerebral fluid. Again, another reference source, there's actually a journal called the Journal of Aggression, Maltreatment, and Trauma. And again, they report that 75% of cranial and cervical trauma associated with domestic violence occurs from injuries to the mouth. As such, dentists could spot potential victims of domestic violence in patients when the patients are visiting for treatment or consultation. Again, that same journal did an article in 2019, traumatic brain injury and domestic violence victimization. So the studies show that the majority of domestic violence cases have a history of trauma to the head or neck, resulting in both TBI, and TBI, as you know, that stands for traumatic brain injury. So the majority of these domestic violence cases actually have a history of trauma to the head or neck, and many of them, a high percentage, have a TBI, traumatic brain injury, and oral maxillofacial damage. And that oral maxillofacial was that front picture of the skull that we just showed you. That's oral maxillofacial. And however, distinctive oral injuries that are sustained simultaneous with the brain trauma, they can be, again, the dentist can notice the oral injuries and look for signs of brain trauma if the patient appears confused. Signs that could indicate brain injury include jaw and tooth fractures, trauma to the mouth and nerves, and lesion to the nasal bone. Here's a testimony of a survivor. I had my jaw broken and nerve damage, and I have trigeminal neuralgia due to domestic violence, which thank God has improved so much the last couple of years. But I was told my teeth would suffer badly, and they did. For the first few years, I ground my teeth so they were grinding and clenching their teeth in their sleep from stress, so badly from the injury that they just look awful now. I don't have the best teeth anyway. I really hate my teeth. I just think, well, what's on the inside is what counts. Again, CTV Canadian content. Many brain injuries caused by domestic violence go untreated, say the experts. Here's another testimony of a survivor. I received a TBI from a domestic abuse situation. My ribs were kicked and 4 ribs broken. One went into and collapsed my lung, and steel-toed boot kicks to the head, causing the TBI. I went 3 days with very low oxygen due to collapsed lung. It was terrifying. This was 6 years ago. I am now a DV advocate, and I'm able to help other survivors. So again, these victims, they experience TBIs from blows to the head and other assaults. and they have open or closed injuries to the head. TBIs are characterized as short or long-term brain damage, and this could cause physical damage, loss of consciousness, headaches, sleep disturbances, sensory, vision, auditory distortions, sensory to light and sound. So sometimes when these patients come in, they want even the lights shut off in the room. They don't want the lights on, just the exam light. They're so sensitive to the light. And distortions and sensitivity to light, cognitive, executive control and memory, and mental health, depression, anxiety, mood fluctuations. And again, all the funding and all the attention, which is a false paradigm, all the attention goes to the professional sports athletes in the NFL, the NHL, and in the military, but actually domestic violence leads the category of concussions. But domestic violence is ignored for funding, and it's ignored by science research. So much money goes into investigating concussions in sports, there's no money to be made from studying intimate partner abuse. Domestic violence survivors often have undiagnosed and untreated concussions. It's the hidden epidemic of brain injuries from domestic violence. I had my jaw broken. The domestic survivors are now getting free treatment from dentists to mend injuries. That's a program in the UK, and hopefully someday they have that similar program organized here in Ontario, Canada. Again, another Canadian content, the Ontario Brain Institute, OBI, and a great reference source for materials on concussions. And then there's a CTE, which stands for chronic encephalopathy. And so it's linked with memory loss, confusion, mood changes, depression, and eventually dementia. Some scientists think domestic violence survivors might be at risk for this. CTE is connected to a history of repeated head trauma. And again, although researchers don't yet know precisely what causes the condition. And so it's CTE stands for chronic traumatic encephalopathy. And again, it's a degenerative brain disease that can only be diagnosed during an autopsy after the sufferer's death. So the brain, again, isn't a hard fixed organ. It's more like jello surrounded by cerebral spinal fluid that works as a shock absorber when the head is hit. So whether it's a violent blow from a football or a blast of explosion after a partner's angry fist, it can damage brain cells at the point of impact and slam the brain against the skull, sometimes bruising tissue, tearing nerve fibers, or causing bleeding. Again, there's the signs, symptoms of a concussion. And a TBI victim, if a first responder comes and to the home of the domestic violence abuse victim, it's very unlikely that they're going to say I sustained a brain injury. They're going to say more like things like, we were arguing and then I found myself getting up from the floor. He punched me in the head. I fell backwards and hit the wall. Or they're going to say, because they're dazed and confused from a concussion, they're going to say, I'm not sure how I got into this room. I don't know what's going on. And how is this relevant? Well, the police and the first responders, they're going to see this person saying, well, I don't know what room I was in. I don't know what happened. They're going to assume, oh, this person's on drugs. This person's on alcohol. This person's incomprehensive from being on drugs or alcohol, when the actual fact is that that's totally untrue, that they're just had suffered, these are signs and symptoms that they just suffered a concussion. And then even the judges in court and the advocates, the lawyers and the friends and the family, they need to be sympathetic and understand that it might be a concussion, and it's not jumping to conclusions saying that this person that's the victim and the survivor, that they're somehow on drugs or alcohol. And there's some recommendations for working with women with TBI. Focus on one task at a time, talk slowly and to the point, double check with her to be sure that she understands the information, help her to fill out forms, help her to make phone calls, and help her in identifying support personnel. Be supportive and identify her strengths. So it's estimated that 30% of female domestic victims have sustained at least one TBI. Anxiety and depression are common problems even after a mild brain injury. And at least 35% of TBI survivors, they also suffer from PTSD. And this is our final slide. And focusing the direction of changes. So this is a recommendation again by the Ontario Coroner's Office, the DVDRC, and they're saying that there needs to be a risk assessment done for police, physicians, therapists, lawyers, public education, and especially, most of all, training. Healthcare professionals need to be trained to recognize strangulation, to recognize concussion symptoms and signs. The police, the lawyers, the judiciary, therapists, we all need training to sharpen our minds, to be more observant, the power of observation, to recognize these victim survivors. Child welfare, the impact of DV on children. New legislation needs to be introduced, new policies, even especially domestic violence in the workplace, strangulation, concussions, and judiciary legal, family versus criminal proceedings. So that's our conclusion and any questions. And thank you for watching, listening, and participating. Good evening from Niagara Falls.